Founder and producer, Professor Ahmed Mamdouh El-Sharif, Professor of Epidemiology and Infectious Disease, ex-head of Department of Veterinary Medicine, ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University, presents through this scientific veterinary channel. Technical veterinary learning. Jerusalem is our holy city. القدس لنا والأرض لنا. فلسطين حرة مستقلة من النهر إلى البحر. Malignant Cattrall Fever. Laboratory diagnosis of malignant Cattrall fever disease. For accurate diagnosis of any infectious disease, correct samples have to be collected. In case of malignant Cattrall fever disease, samples should only be sent under secure conditions and to authorized laboratories to prevent the spreading of the disease. Samples taken from any susceptible animal with sudden death, fever, persistence, erosions of the mucosa, nasal lacrimal discharges, bilateral corneal opacity should be tested for malignant Cattrall fever disease, particularly with a history of exposure to sheep, goats, antelope, or wild beasts during parturition. Samples are blood in a tube for virus isolation and PCR tests. Fresh tissue collected and refrigerated immediately after death for histopathological infection. Spleen, lung, lymph nodes, adrenal glands have to be collected and refrigerated immediately after death for histopathological examination, as well as for viral isolation. Laboratory tests in case of malignant Cattrall fever: virus isolation and identification, complete blood picture, experimental inoculation test, serological tests, histopathological examination, and molecular diagnosis. Viral isolation and identification is not practical with the fact that oven herpes virus 2 does not replicate in the cell culture. Only alpha-line herpes virus can be isolated in tissue culture. CBC or complete blood picture, leukopenia commencing at first illness and the progression to a level of 3,000 to 6,000 microliter has been recorded, but it is not a general observation. The leukopenia recorded was mainly the result of a granulocytosis. In our experience, moderate leukocytosis is more common. Experimental inoculation test. It is used for diagnosis by using whole blood, nasal swabs, and nasal washings, and preferably lymph nodes that collected by biopsical samples, histopathological lesions in the recipient rabbits or calves as critation. Histopathological examination. Malignant Cattrall fever is characterized by prevascular monocular cell coughing in most organs and by degeneration and the erosion of affected epithelium. The pathognomonic lesion is a necrotizing vasculitis that features infiltration of the tunica media and adventia by lymphoblast-like cells and macrophages. Acidophilic intracytoplasmic inclusion bodies in neurons have been seen. Large numbers of inclusion bodies have been observed in the tissue of artificially infected rabbits. The histopathological features of panophthalmitis have been described. An operative arteriopathy is characteristic, and this is vascular lesion is present in all major organs. This is a picture of histopathological lesions characterized by vasculitis, predominantly prevascular lymphocytic inflammation of the brain, hematoxylin and eosine stained kidney sections, highlighting the accumulation of lymphocytic cells around a small arteriole or dashed curves. Arrow head indicate renal corpuscle. Serological diagnosis: alpha-line herpes virus 1 antibodies in wild beasts, immunofluorescence in ruminants, indirect fluorescence technique for detection of bovine herpes virus 2 antibodies in sheep and cattle. Serological examination: competitive inhibition ELISA tests for screening, competitive ELISA using monoclonal antibodies to broadly conserved epitope of the malignant catarrhal fever virus, can be used for detection of antibodies and has largely replaced other serological tests as it is more valuable, sensitive, and accurate. Disadvantages of serological examination: the antibody titers is low and there is cross-reaction with other herpes viruses. Serological tests have limited value for diagnosis of clinical cases because only a small percentage of animals seroconverted and so late in the course of the disease have been reached. With most of animals, they are dead within 3 to 10 days. The development of antibody following infection is delayed in a significant proportion of young animals. Serology is unreliable for determining infection status until after 1 year of age. Uninfected lambs or kids under 4 months of age may test positive because of the presence of maternal antibodies. Molecular diagnosis of malignant catarrhal fever disease. Number 1, quantitative PCR. The Buffy code is probe positive 2 days post-experimental infection with alpha-line herpes virus 1. Virus can be present in cattle without clinical malignant catarrhal fever, and if these have a disease that is not malignant catarrhal fever but test probe positive, this is a false diagnosis is possible. Number 2, sequencing of positive samples to know where from and why this type of malignant catarrhal fever virus reached to that area. This is a phylogenetic relationship of ruminant species that develop malignant catarrhal fever clinical signs and lesions or symptomatically carry off malignant catarrhal fever virus. The upper part is clinically infected with malignant catarrhal fever. The other is asymptomatically carry of malignant catarrhal fever virus. Phylogenetic tree based on the predicted ORF9 DNA polymerase DNA sequence of known members of the genus Macavirus. Confirmatory tests for malignant catarrhal fever disease is a PCR technique, immunohistochemical stains. Both tests confirm presence of viral antigen in the whole blood or in tissues harvested at necropsy. Differential diagnosis of malignant catarrhal fever disease. Bovine viral diarrhea, blue tongue, rinderpest, foot and mouth, vesicular stomatitis, all of them are diseases have to be differentiated from malignant catarrhal fever disease. Pneumonia complex, oral exposure to caustic material, mycotoxicosis, poisonous plants, salmonellosis are also have to be differentiated from malignant catarrhal fever. Treatment. Treatment of affected animals is unlikely to influence the course of the disease as it is fatal. Just we give supportive treatment for the animal to prevent his pain. Non-steroidal anti-inflammatory drugs may cease the discomfort. Mortality rate reaches to 100%. Supportive therapy and antibiotics for secondary bacterial infection. Survival is rare and seldom recovered animals in case of domesticated cattle have been declared. Control. The recommended actions for controlling of malignant catarrhal fever disease is notification to veterinary authorities, quarantine, different steps according to the epidemiological situation of the area, region and country. Disinfection by any disinfectant and sunlight will destroy the virus. Samples of disinfection by ether 20%, chloroform, formalin 1%, some detergents, phenol 2%. Unfortunately, there is no vaccination. Separated infected and carriers animals from susceptible species. Sheep and goats, rare carriers, so have to be separated from cattle partners. Avoid exposing cattle, bison, deer during parturition. Zoological parks must introduce seronegative animals only. Isolation of affected cattle is usually recommended. Introduction of sheep from areas where the disease have occurred before to farms with cattle should be prohibited. A program to produce sheep free from bovine viral herpes virus 2 infection by separation and isolation of lambs before they become infected is recommended for sheep used in petting zoos. An effective vaccine is not available and is likely to remain unavailable in the foreseeable future. Attempts to immunize cattle with live or inactivated culture vaccines with Frandus incomplete adjuvant don't provide any sort of protection against experimental or natural challenge by exposure to wild beast herds. Completion of recommended actions for control an inactivated wild beast associated malignant catarrhal fever virus vaccine has provided protection against the challenge with virulent viruses. Establishing a respiratory mucosal barrier of antibody currently thought to provide the best chance of protection immunity, but this will be challenging to attain with intramuscular or subcutaneous vaccines. All of that is under research. Keep on the track by following the scientific channel Technical Veterinary Learning for more accurate scientific discuss and clearance of all infectious diseases belonging to animals all over the world. Thank you for subscribing.